Hey, this is Dr. Corey Glenn. I'm going to show a video here of one of the techniques I use when I want to do either a permanent restoration that is made out of printed material, or if I just wanted to have really strong full arch temporaries for immediate load. It can be used equally well in both capacities or both at the same time, which is what we're actually doing here. So just to get a grasp on the case, this is the patient preoperatively. And so the patient does have existing teeth. I'll turn those on where you can see them. So the way this will work is how I do my stackable guides. Basically, you'll have an initial tooth supported guide that will go on, just a resin printed one. And this is not the high resolution, but you'll get the idea. I do have that in here. But you would seat the guide on here. You've laid your flap, and all you're doing is drilling pinholes. So in this case, there's actually going to be 5 pinholes drilled, and then that guide comes off, you throw it away, you're done with that. Okay. Now at this point in the system, the way I do it, you would go ahead and extract all the teeth with no guides in place. Everything's out of the way, and that would leave you this jaw. And now you can see where the implants have been planned here. Believe I've got the lower wax up where you can see it. Yes. So you can see my implant emergence positions, and in this scenario, and I prefer this when possible, I was actually able to not use any angled implants. So I have nothing against those, but they do complicate life having to do the angled multi-units and everything. So if I can do everything straight up and down and there's not some stability reason why I need to go angled, I'm always going to do them straight up and down. And that actually is really helpful for this technique, as you'll see here in a moment why. So we've got the implants planned prosthetically, and so in this scenario you would have those 5 pinholes drilled, and I'll turn on all those pins just so you can see where they were. So these would be the 5 pinholes that have already been drilled, and now turning those off, you can see how it'll look when we go ahead and place the reduction guide. So here is the reduction guide, and the way this is set up is you would actually take this and you would be able to slide this in. Remember, the pinholes are already there pre-existing, so once your extractions are done and now you're ready to start doing bone reduction, you've got these parallel pins positioned in the anterior that kind of go between the implants, and this is going to slide in and self-orient itself against those 3 pinholes in the anterior. And you know you're fully seated when this just slides all the way up against the buccal bone. So there's an intimate fit against the buccal bone. Let me Control Z all this and just leave that in place. So this is how that would look. Again, you can see these pins are built into the reduction guide and they're sitting internal inside of the bone. And a lot of times in this scenario, you'll have to maybe selectively extract 1 or 2 teeth. In this case, I was able to pretty much miss them all. I barely nick the root of this canine, but not enough that it's going to be a problem. So I would just drill that pinhole without extracting that first. So now you could do your extractions. I'm sorry, you've already done your extractions. Now you would do your bone reduction. Okay, so you would just be taking a large E-cutter burr and reducing this bone down to the level of the reduction guide. I didn't mention it, but you do have posterior pins that once this has slid all the way in against the bone, you would drop in these 2 posterior pins, and that just locks everything in place where you can't have any anterior-posterior rotation. So you would now do the bone reduction, which would leave you this jaw. And here you can see now that jaw has been reduced to the proper prosthetic space. Again, all that was determined based off of a wax up, which was facially driven, and then we knew how deep we had to put the implants because we had to create prosthetic space. So basically, if you looked in the anterior, you could measure 15 to 17 millimeters back from that incisor, and that's how deep those implants have to go, and that's how all of this was determined with the plane of reduction and so forth. So what this will be is a magnetic guide. Basically you will have just this in place, you'll do your reduction, and then when you're ready to do the implant placement, you would drop on the magnetic stackable drill guide, which is right here. Nope, that's the wrong one. Right here. Okay. And this is going to index itself in, just so you can see how that works. I will raise it up. So as you can see, there's there's 4 male-female pins, so there's no potential for lateral movement. It locks it in. But really, the other aspect to this is you need it to have retention. It needs to stay in place. There's many systems that do that with interlocking pins. In the way I make them, I just use magnets, and so these wells that you see around each pin are for a 3x3 magnet, which you can purchase, and that will have its corresponding magnet in the drill guide, and then it'll also have the same thing in the stackable prosthesis. So these will have magnets, and that will suck itself into place and self-orient along the pins, and now you would do your implant drilling. Okay, so the implants would go in place, and you can see here that everything again is oriented straight up and down. So that's pretty straightforward with how I generally do these. And most times on my full arch stackable guides, I'm just making a purely printed prosthetic, unless it's requested that it have metal reinforcement. But when you do have this scenario where you've got straight up and down implants, one of my favorite things to do is to repurpose this drill guide into a reinforcement for your hybrid. Okay, so imagine now that if you could put on your multi-units and your temp cylinders, okay, you would have this, and it just so happens with the Blue Sky fully guided kit that you have the perfect amount of relief space around each of these temp cylinders. And so instead of picking up the hybrid, I would have removed this, put on the multi-units, and then reseated the guide, and then screwed on these temp cylinders, the yellow ones that you're seeing here. Those would screw into place, and now you see I have about a 1mm gap all around these, and I would simply pick that up. Okay, so I would squirt the pickup material between the guide tube and my temp cylinder, and then just wait and let that set up for a couple of minutes. And then once I do that, I would have the screws removed. I would take those out, and then all of this drill guide would come off with the cylinders now embedded internally. And if you go ahead and make your temporary prosthesis where that can slide into that, then now by simply cutting off those indexing feet and just leaving behind this bar with the guide tubes, you have a really nice metal reinforced temp. So that's what this video is going to be. It's just how I go about making that. I'm not going to go through fabricating guides and everything, but this is a simple technique that you can use on any case where you've got some kind of a strong guide. This could be milled Trilor, milled Peak, this could be cast metal, this could be any number of things, but if you have a strong surgical guide, then you can actually repurpose that into a reinforcement. Okay, so as far as how we're going to do that, I'm going to jump over here to another window where I've got Meshmixer opened, and as you can see here, this is that drill guide, and what I need to do is I need to build in the slot into which this can slide inside of my prosthesis. Okay, so that's what I'm going to start by doing. First of all, I'm going to need to create a path of draw. So the hybrid in this scenario, here it is, you can see this does have some cutback on it because I fully intend for this to be at least an option for the patient to keep as their long-term definitive restoration. So whereas I usually would just stain the gingiva and print this monolithic, here I actually did about 1.5 millimeters of cutback, and I'll actually place physical pink composite into this. Because one of the downsides if you're going to try to do a permanent printed hybrid is the staining is just going to simply wear off. It's a surface stain that is going to wear off in time, whereas a gingival composite actually has some thickness and some body to it, and it will be there indefinitely. You could always polish it up, but you're not going to polish away the gingiva and make it look unnatural. Okay, so I've got to create the negative space inside of this temporary to drop this bar into. Okay, so to do that, what I'm going to do here is I'm going to go ahead and first of all delete out the internal of each of these cylinders, because that's going to be irrelevant. Remember, that's all occupied by the temp cylinder at the time when we go pick this up. So a quick and easy trick that you can do to do that is go up here to Edit, Generate Face Groups. And when you're generating face groups, the software is just looking for angle changes within the mesh of your STL, and where it finds those, it will generate a color or a face group for all of the angles that are of similar shape as that one. So you can see like these right 90-degree angles here, that turns it into a separate face group. Whereas here, this is all still one solid face group, because the angle threshold of that was not enough that it wanted to change it here. Now you can, when you do generate face groups, you can play with that angle threshold. Let me do this one more time. So if I set a higher angle threshold, you can see now I get even fewer face groups. If I go the other direction, I can actually get a significantly higher angle threshold. So now you see how even that slight change in angulation, it's picking that up. But the internal of these tubes is all just one smooth surface. So really, regardless, I end up getting just a single surface interior inside the tubes, and that lets me just double click it, and then I'm simply going to delete them. Okay, so those are all selected. I'll push delete, and now I'm going to repair those holes. So inspector, auto repair all, and now I have this shape. Okay, this is just again my same surgical guide, only with the holes closed in. So let's export that and take that back into Blue Sky Plan. So I'm going to say drill guide for path of draw, POD for short. Okay, and now inside of Blue Sky Plan, let's hide some of these files. I don't really need to see all of these at this point. I'm going to pull in that file that I just created. So import STL. And here we see that drill guide for path of draw. I'm going to pull that into Blue Sky. Now you might be wondering, why didn't I just do a straight up Boolean subtraction? Well, because there's too many undercuts and angulation differences, and if I did that, now I'm going to have to spend a lot of time trying to adjust that in, and it would just be a huge pain in the butt. So now you see we have this imported into Blue Sky, and I need to generate a path of draw over this, okay, because I want this to all uniformly insert into my temporary. And so the easiest way to generate a path of draw in Blue Sky Plan, in my opinion, is just to go to the to the denture module. And now that we're in the denture module, we're going to basically trick the software into thinking that we're making a denture, because the first step of making a denture is giving you the option to block out any undercuts. So that's what we're going to do. We're going to tell it we're going to build a denture on this file that I just pulled in, right? The drill guide for a path of draw. It's on the mandible, so I'm going to indicate mandible. I really don't need to see these implants, so I'll turn those off. But one of the things you will have to do is turn some teeth on, and I'll show you that. If I just now tried to say create denture, it's going to tell me that there's, first of all, there's no teeth, and secondly, I have to define the mandibular teeth chain. So I don't have to turn them all on. I'm going to just pick any two mandibular teeth and then say mark these visible teeth for chaining. Now it'll let me proceed with making a denture. Okay? So you see when I click that, this very first step is actually the step to indicate my path of draw. And what I would like to do is basically, you know what, I am going to turn the implants back on here. I want to pretty much get a uniform path of draw down, whatever the most uniform path of draw across all of those mandibular implants is. So here you can see I can see a little bit of the lingual of these anteriors. Back here I can't see the distal, but I can see some of the mesial. So that looks pretty good to me. All right. And now that I have this oriented on my screen the way that I want to create the path of draw, then I need to come up here and say I don't want to allow any undercuts. So my maximum allowable undercut is 0. Excuse me. And while I have this oriented properly, I'm going to say set my insertion direction from this view, meaning it's going to pour a path of draw directly into the page here. And now you can see, if you didn't miss it, that arrow is just a tiny dot now because it's going straight into the page. Now you can see it. So again, anything you're seeing here that's in that dark brown, that's undercut. That would have been stuff that if I had just done a straight up Boolean subtraction, I would have had to have done a ton of adjusting on that, and I don't want to. So here I'll be able to block out those undercuts and get a perfect subtraction where this thing will drop in there. Okay, so let's push next, and it's going to generate that path of draw. And now this is what I was after. So again, I'm not really making a denture. I was purely after this model right here that's just been generated. And so what I'll do here is export this. I don't want to export any teeth or any other models, just this path of draw. And I'll call this guide bar path of draw. All right. And I don't need to do anything else in denture module, so I'll just kick back over to Blue Sky Plan, or to surgical guide module, and now I'm back to Meshmixer. I'm going to pull that in, the file that I just created, guide bar POD. So remember, there's the original drill guide, but here it is with all those undercuts blocked out. Okay. Now, if we turn back on the hybrid right here, I could just do a straight up subtraction of this, but here again, if I do that, if you do a dead zero subtraction, it's still not going to fit in there because printing's accurate, but it's not down to, you know, the level of accuracy where you can have a dead zero, you know, cement spacer and it's going to fit. So what I need to do instead is that I need to create a little bit of an offset spacer. Think of this as your cement spacer in a crown. Okay, so what I'm going to do is just select all of this, and I'm going to go to offset, and I find usually that a 0.3 offset is pretty ideal. Okay, now when it does this, it's going to default to whatever the last distance you used when you did an offset, which right now this is set at 0.55. I don't want that. I want a 0.3 offset. So I'm going to change that and then just click somewhere and let it reconfigure. Okay, and now we've gotten that, and so this has offset that entire surface for that path of draw by 0.3 millimeters, or 0.3 of a millimeter. And so you can see that little bit of spacer right here. I'll just accept this. And once you accept it, that newly offset surface is still going to be selected orange. So while it's selected orange, let's go up here to edit and separate, or you can hit the hotkey Y. And now that is its own distinct STL from this internal one. Okay, so I don't need the internal one anymore. I'm turning that off. And this is what I can now subtract. Okay, now just in case you're wondering, you know, I'm going to do it with the little arm extensions still present. You know, I would, when I actually do this clinically, I'm going to go and help the doctor do this case in their practice, or at least oversee it. And we will, before we do this pickup, we'll actually take that drill guide that they've picked the cylinders up in, and we'll section it right here. Okay. But for purposes of me being able to fit it on the front end and all that kind of stuff, I want to be able to verify that everything is seating and all that. So I'm just going to take a little bit of extra resin and fill in these holes where it leaves a void there. So let's now do the Boolean subtraction. So I'm going to select my hybrid. This is what I want to subtract that from. and then I'll control select in my objects browser this offset path of draw, and then this menu pops up, click Boolean difference, and there we have it. So I'll accept that, and again, I will have to fill in this space, and that's okay. I'm aware of that. I won't do that clinically. I just want to be able to print all this stuff and fit it, make sure everything's seating beforehand, and I'm not going to go to the expense of printing 2 of these metal drill guides, one with it sectioned off. It's just unnecessary expense when I can flow some resin in there. Okay, so now this is what I've got, and I'm going to just inspect it, make sure there's no holes. Looks good. So I'll save this now, and we'll call this hybrid lower with cutback and space for bar. Okay, I don't care what you name it. Name it anything you want. Just make sure you're specific enough that when you go back to your folder that has like 50 files, you can recognize what that is. Alright, so let's now turn on the lower drill guide. Actually, this is the one I closed the holes on, so I'm going to import the original back in here. Alright, and now you can see how all this sits together. Okay, so again, let's go through the concept here. We'll use the original pin guide just to drill pinholes, take it off, throw it away, do your extractions, and now this reduction guide is going to slide in along those 3 anterior parallel pins. It's very important those be parallel. When it sits all the way against the bone, you drop in the 2 posterior pins. So it's a lot less fiddling to deal with stuff because you don't have so many pins to manipulate, and the fact that these are fixated and there's 0 wag factor or wobble between the reduction guide and the pin. I find that they're more stable as well, but that's just personal preference. When this slides in, you pin it into place. Now you can you've done your extractions. Now you reduce the bone down to this level. Now you put on your drill guide, and now you do your guided implant osteotomies. Okay, and then you would place your implants fully guided. And then if I'm doing this, I would take this off momentarily. I would put on the multi-unit abutments on each of these. I always make my temporary prosthesis sit 3 millimeters up above the newly reduced bone. That's the ideal space for tissue. And so I would use a 3 millimeter multi that would screw into the implants here. And then once those multis are on, I would put this back in. Okay. Now all you have to do is drop your little temporary cylinders into this space, right? These. And then screw them down. There would be a hole coming through here. You would screw these things down. So here's what, other than the fact I'm getting a metal reinforced temp that could serve as a permanent, the other aspect I love to this is I don't like doing these pickups in the mouth. Had too many times where blood gets into my screw hole and it looks messy. The holes inside of the prosthesis are excessively big, meaning I have to rebuild them now. It's just not ideal unless you're purely doing it as a temporary. The beauty of this is that I'm not picking up my cylinders inside of the temp. I'm picking up my cylinders inside of this metal bar. So if a little blood gets in there, I don't really care. I've got much better visibility because I don't have such a deep channel to do the pickup in. And so I would simply pick this up now with the pickup material of your choice. Fast set acrylic, quick up, anything that you want to use. I would just suggest using a dual cure because you're not getting light through this bar, right? It's just not going to happen, and you're going to get minimal light shining down from the top. So I like a dual cure resin because that way I can initially set it with the light and get it where everything's stable, but then I'll let it finish out the dual cure so that it's really thoroughly cured all the way through. And that tends to hold up really nice over time. Okay, so now that you've got this, you would undo your screws. It's all set up, and now you take all of this out together. Okay, now disregard the multis. Those would stay on. It's just that these are all kind of as one piece right now. But I would pull this drill guide out with those MMUTC temporary cylinders embedded. And now everything else as far as this prosthetic conversion happens outside of the mouth. Okay, I'm going to delete these guys. Oh, doesn't look like I can. Well, let's just pretend we're deleting, so I'll just plain cut them off. Okay, I've got these now, and this space between these has been now filled with resin, which is set up. So the cool thing now is I can do the rest of my conversion on the lab bench top, where it's clean, it's controlled, there's no blood, I'm not fighting the patient, keeping them open, all that kind of stuff just goes away because now the remainder of my conversion happens on the bench top where it's controlled. I can be very specific with where I apply materials, and I'm not in such a hurry either. And so now this would simply drop in to the hybrid. Okay, all of this would seat into this just like so. And again, if I'm truly doing this clinically, before I do that, I'm going to take a carbide burr and just chop off each of these indexing feet, because you don't need those anymore for spatial orientation, right? Originally, that's what's keeping everything positioned properly in space so that you can do the pickup and know everything's in the right position. But once you've picked those cylinders up in here, now that is what's holding the space. And all of this was predetermined, you know, they were in the right position. So the subtraction, this is only going to fit into your temporary one specific way. So I can't get off and screw up my bite or my VDO or anything like that. You would just simply take some more dual cured resin. I would plug the top of your implant chimney cylinders so that you don't block yourself out. But just place more dual cure resin in here and seat this. Press it down nice and firm, make sure it's fully seated, and then just let it set up. Okay, now here, because you're on the bench top and you can see this upside down, if you've got a bunch of excess resin that squishes out, take a brush and just wipe that off to save yourself a lot of cleanup and grinding and polishing. Okay, it's going to be a really clean workflow for you. Now the one thing I haven't shown yet is, and if you're sharp you probably picked this up, but we had these cylinders, right? And unless I chop these things down to flush with the tube, then there's no place subtracted out for those currently. Okay, so that's an easy fix. I'm going to just cancel that. What I'll do right now to do that last step is I'm going to take all of these cylinders, and first of all I'm going to make them solid. So let's go edit, make solid. And I don't care really that I'm losing that resolution, because I'm actually going to create some spacer, so it honestly probably helps me. I'm going to select them all, that's Control A, and I'm going to offset these by 1 millimeter. That way if there's a little variance, you know, in how the implant goes in or whatever, it's not going to be a huge deal. Actually I'll go like 0.75. Okay, so we've got that. Once again, it's still selected after I accept it, so I'll hit Y. And now I've got the originals and the offset. Okay, so the offset ones is what I'm after, and I'm going to go find my hybrid again. If I can remember where that is. There we go. And we can now go ahead and subtract these. Okay, so if you wanted to, like if you knew for a fact that you're not going to keep these cylinders sitting that tall, you know, maybe you end up chopping them down here so that you can leave the occlusal surface of your temporary fully intact and not have big holes to make. That's a reasonable thing to do. Or if you don't really care about that much and you just want to be able to subtract this and know you'll have a little bit of a screw access hole at the occlusal to fill in, then you can do that. Here, I'm not really worried about it. Most of it is here on smooth surfaces, which that's going to be really easy to fill in. The only others are in these first molars, which that's going to be an easy solution to fill that in. So I'm just going to do a straight up subtraction. So I'm selecting this, Control select your offset cylinders, Boolean difference. And now you can see that all of that will fit completely down without bottoming out on the tops of those cylinders. Okay. So actually, before I accept that, I'm going to do it both ways. I might play with both of these because this is cheap. This is printed. I can always print an extra for just a couple of bucks. So I'm going to do one each way just so that you can see it. So let's hide that duplicate for a second. Now I'll go back and do this. I'll accept it. Okay, I see a little error in the mesh right there, so inspect it, fix it, done. All right, this one I'm going to call hybrid for bar reinforcement with full length cylinders. Because this is assuming we didn't have any of those chimneys trimmed. Now, while that's not that difficult to do realize that at some point, if they're sticking out above, and they will be here, then you're at some point going to have to trim your chimneys down somewhat, okay? Because you don't want to have what feels like a lingual tumor on their hybrid prosthesis, right? So a little bit of that needs to be cut off. The posterior ones, just this one does. That one is maybe it needs to come down a little bit. Okay, so if you go this route, you're going to have to be doing this after all of this is set up. And the downside there is you've got to be real careful that you don't nick up your prosthesis during that process. So let's go the other option. If I really wanted to be fancy, what I could do is I could make a jig and actually pre-trim all my cylinders to the perfect height. So let's just show you how I would do that. Let's find the original cylinders. Here we go. And what I'm going to do is I'm going to go and grab my hybrid prosthesis that I made prior to any subtractions or anything like that. So that is going to be the teeth and the gingiva here. Alright, I'm going to just turn those into one solid model. I don't have to be super precise on this, so I'm not going to do like a highly precise solid model. But if I wanted to know how short I need to make these, then I can actually do that here. So think with me for a moment. If you wanted to ensure that your cylinders are sitting at least 1 millimeter below the intaglio of your hybrid, how might you do that? Well, one easy way is I could take this solid prosthesis that's not been subtracted from or anything like that, and I could do one of two things. I can either select this whole surface and offset it by -1, and that would show me where it interfaces with each cylinder, and that tells me trim the cylinder to right here, and that way you know it's going to be sticking 1 millimeter below the occlusal surface. The other way you could do this is you could say hollow this. Now, that may seem counterintuitive, but right now this is a 2 millimeter offset distance. That's your wall thickness where it's hollowing it. What if I change that to 1 and update it? Now you can see I've basically taken this whole prosthesis, and that inner shell of my hollow is 1 millimeter reduced in all dimensions. So I'm going to accept that. And then remember, I've got 2 shells here. So if I'll select the outer one and then I for invert, so now the inner one is selected, I just can't see it. And now I'm going to hit Y for separate. And that's what you've got. So to flip that, select it all, flip normals. Okay. Now this tells me exactly where I need to trim these cylinders to, okay, which is a useful thing. So let's say that I wanted to actually, I know I'm doing this procedure guided and everything. I'm not doing it, the doctor is doing it. If I really wanted to streamline this and save a lot of time and tinkering around during the procedure, I could actually trim all my cylinders to the proper height beforehand. Okay, so that's what I'm going to do here. I'm going to select basically where the mesh is on each of these cylinders. Okay, and I will hit Y to separate it. I don't need this whole thing. And so basically everything from this mesh up I need subtracted. So let's just select all of that and just extrude it up a bit. It doesn't matter which direction. All I care about is this. Okay? And now I could take this and Boolean subtract this. Boolean difference. And there we have perfectly trimmed cylinders. I could measure those. I could either print these and then try to trim them to the same shape, or I could simply measure them, right, and then trim them to the same shape, however you want to do that. Okay. Now I would anticipate I'm not going to get so precise in my trimming that I maintain these shapes, so I'll probably just go in and plane cut these to flat, something like this. And this is your other way of doing this. For example, if you're using those blue sky temp cylinders, well, then you can simply look and count the number of ribs and say, okay, I need to trim up to this rib, and then label that one for whatever site. If you got a titanium anodizer and you want to color code it, you could do that. Anodize each of your cylinders a different color and say, okay, the blue one, or the one I've anodized blue here, and which I've trimmed to the right height, that goes in tooth number 19. Okay, really saves you a lot of time chairside. All right, so I'm just going through and plane cutting these. Edit, plane cut. And I'm just trying to make that a flat cut across here. Plane cut this one. Okay. And we'll just do the remainder. I'm going to time lapse this just for the sake of the video. You get the idea of what I'm doing here. Okay, so this represents perfectly trimmed cylinders that would all, sit 1 millimeter below the occlusal surface of that restoration. And that has an advantage because that would allow me to keep 100% of my occlusal anatomy on the hybrid shell that I'm going to create. And so I'm going to save this right now, because remember, I'll need to reference that when I'm trimming it so I can count the ribs to know how many I'm doing. This is temp cylinders trimmed to 1 millimeter below occlusal, whatever. Now I'm just going to repeat the exact same thing I did a moment ago with the full length cylinder. And that way I've got either option. I'll experiment with it, see which one I like. I usually will do multiple steps either way just to document it. So let's select it all. Let's offset it again by 0.75 millimeters, which hopefully it'll default to. Oh, you know what? I'm glad I remembered this. I offset the top surface of this as well, which I don't really want to do. So what I'm going to do is actually delete these. All right, now we're back to here. What I want to do is not select this, because the height, I know I'm going to trim those precisely, and if I'm creating a big buffer space up above that, then I'm potentially going to poke back through my occlusion again, and I don't want to do that. So I'm just going to select all of these white surfaces. So I can hit G, expand to groups, and what that did is it did not select the top of these. That's what I'm going to offset. So edit, you know what, I keep forgetting steps here. I need to make this solid as well. Let's make it solid. That's fine. Now I've kind of lost those face groups, so let's just select it all, or I'm sorry, go to edit, generate face groups. Okay, and I'm going to just click G, that's expand to groups. I'm just clicking on the top surface of that, and now that I've selected those, I'm going to hit invert. This is what I want to offset. Offset by 0.75. I'll accept that. Remember, they're still going to be selected, so I'll hit Y. And now I'm going to probably smooth these up a little bit as well. Deform smooth, like that. And I'll also smooth the boundary up here at that top edge by hitting B. And now what I can do is just repair those holes. I'm going to just fill in with a flat fill the tops of those. And that should be roughly, you know, where the top of my original cylinders were. See that? And if it's not, you know, if I turn back on my original here, I can see that these couple are actually sitting a little too low. So I'm just going to select that top surface. Oops. Okay. And I'm going to hit D for extrude. And I'm going to just extrude those up just a hair above that. Okay. And this one actually needs to come just a hair more. I'm going to just do like 0.3. I can do less than that. 0.2. How about 0.1? Alright, that works. Alright, now I'm going to subtract this from my, remember the duplicate I made of this earlier? That's not the one I want. Getting too many objects over here, so I'm going to delete a few of them. There, that's what I was after. Okay. Now I'm going to subtract these guys from this. Control select, Boolean difference. And now I've got the space built in for the chimneys, at least to where I'm going to have them trimmed to. And that means I have still perfect occlusal anatomy on the top. Okay? So I probably lost a majority of you in what I was doing there, but let me try to see if I can explain myself. You know that those original cylinders, just we could look and see they were going to be sticking up, right? That was going to require us doing a lot of metal grinding, which I generally don't like to do chairside because it slows down the procedure. So if I know exactly where I should trim these to make them sit below the occlusal surface so that they can be filled in over, then why don't I just trim my cylinders to that height ahead of time before the procedure, and then you could just lay these out where you know which cylinder goes with what. Okay, so that's what I did. I did it a fancy way, but you could also just eyeball that. That's fine. So for the doc I'm helping out on this, when I get to his office, I will, before he even numbs up or anything, I'll go back and trim each of these 6 cylinders to the right height where I want them to be, which is what you see here. And then we'll do the procedure just as described earlier. We'll place the multis, we'll put these cylinders into each correct spot, screw them down, and then pick them up internal here by squirting the dual cure resin. And now I'll have exactly what you see on the screen here, only in the physical parts. And now you take that and you can do your benchtop conversion where you seat this into this guy, okay? And you can see how that looks. Actually, that's my same one from earlier. Yeah, that's the one. Okay. So now I could pick up the whole bar assembly on the bench top, and I know that I'm not going to have any cylinders that get this thing out of whack and make it not fully seat. It's all going to be in the right position. Now the last thing you should be wondering is, well, okay, but now you have no holes to screw this into. And this is where I'll actually take a drill. When you look at the bottom side of those chimney cylinders, right, it's a hole all the way through. And you can measure that hole and then just grab a drill bit that is that same size. And now with this thing all assembled, drill from the underside after this is all set up, and you'll just punch your way out through the top of the restoration. Okay? And now you've got a very precise screw hole that doesn't damage a lot of your occlusal anatomy. Okay? So let me just show kind of a final mock-up of what all this is going to look like. Okay, so I did some tweaking here, and all I did was go ahead and cut off the indexing feet, and so this would be what I'm picking up inside of this temp on the bench top, right? We've picked up the pre-trimmed temp cylinders inside of that bar. Once that sets up, it all comes out of the mouth, and now you could just on the bench top cut off those indexing feet with the magnets and pins, and you're left with just this, and then that is only going to fit into your temporary, which you've got pre-made in this one way, just like so. So you just press that home till it's fully seated, let that set up with some resin cement internal, and now all of this is bonded together. Okay, you're going to take, since you've got an intact occlusal on this one, you would take a drill, because remember there's a hole running through the center of each of these. Take a drill that fits in there and just punch from the underside all the way through. Okay, you wouldn't need any screws or anything in place while you're doing that pickup. So just punch all the way through. That's exactly where your screw access hole is going to be. So now you've got your screw access hole, so you can screw it down, and your only bit of finishing is going to be filling in these voids, right? Fill that in. I would suggest using the same resin that you're printing the temp out of, or in this case you could just use gingival composite, although that may get a little pricey. But either way, you'll fill in all of that. And then if you do have little isolated areas like here, for example, where, remember, our temp is designed to sit exactly 3 millimeters above the tissue. So if I've got a little bit of that corner poking through, I could pre-reduce that, before I even do the pickup. If I wanted, I could go in and out, pre-adjust that. Generally, the place where that's going to be most noticeable is on the distal, where the bone kind of starts to curve up. And you won't be able to fully adjust this down, but I would probably take just this corner off right here and just grind that down. This thing is going to be insanely strong, so you don't have to worry about keeping that for strength. I would be more concerned with trying to keep the intaglio smooth, cleansable, and again, that's going to work great. I'd probably trim that as well. Okay, and then once this pickup is completed, you do need to make your intaglio be completely smooth, cleansable, no concavities. It should all be ovate. And so here again, if I printed this out of, let's say, Onyx or Flexera or whatever. If this was printed in Onyx, then I would have some Onyx that I've sucked up in a syringe, and I would flow it over any of these little areas so that really the only metal that's exposed in the patient's mouth is the bottom of these temp chimneys, okay, where that interfaces with the multi-unit abutment. That's going to make this really, really smooth. It'll look nicer, but at the end, I want you to consider what you have. You're going to have a hybrid that is printed in permanent crown and bridge resin with gingival composite on the facial where it can't wear off, with an insanely big, strong bar internal. You're going to have as good a passivity as could possibly be, because you've got no potential for shrinkage. You're not relying on a mill and the accuracy of your scanners, right? The only warpage or shrinkage or distortion, whatever you want to call it, that possibly could happen is in that tiny gap between your cylinder and here, and it would just be whatever the shrinkage rate of your pickup resin is. And that's going to be so nominal that I would put this up against the passivity of a hybrid that's been created through photogrammetry and then a very precise mill. Like, I don't think you could discernibly tell the difference in the passivity of this. So here again, why is this not a great option as a final restoration? And the only thing people will throw up at me is that, well, you won't have the translucency of milled, and I give you that. This will not be quite as aesthetic, but there are so many people that would love to have this treatment, need this treatment, that incisal translucencies are the last of their concerns. Think about what most patients want. They want toilet bowl white anyway. So no one would say, well, I can't afford it, but I'm going to keep going with my denture because I really need that incisal halo, right? That's insane. No one says that. So you're going to have a very strong restoration. What's the worst that can happen? They chip a tooth? Well, this is actually repairable. It's all resin. Whereas your zirconia, if you chip a tooth on that, you're dead in the water. You are starting over. So again, I challenge anyone to consider this as an option for permanent prosthetics, especially for your patients who are financially challenged and can't afford your, $20,000 zirconia hybrid or thimble crowns or whatever. Why is this not a perfectly good clinical solution for them that is 95% as good on the aesthetics? I will be waiting, and I doubt I'll hear from anyone wise to that isn't a good option. So anyway, kind of geeked out on this one. Sorry it was long, but again, I think that's super cool. So hope that helps.